Hi, good afternoon. This is Dr. Michael Yoon. Today I want to talk briefly about disc health, and some of the questions that people have been asking me is how do I take care of my disc so it doesn't continue to deteriorate, or how do we prevent any disc bulge and disc herniation? So here is a model of different phases of health of our lumbar disc or lumbar spine. And this one right here represents what a normal healthy disc would look like. And this is actually phase 1 degenerative changes, where the disc is starting to thin out and the fibers of the disc are starting to cause a little bit of damage on the surrounding area. And this is when the disc starts to deteriorate even further, causing dehydration, and same time leading to some bone changes and some degenerative changes, along with possible bulge that comes out and potentially cause some irritation to the nerve root. And this is an advanced stage of disc degeneration in which the disc itself is quite dehydrated. You can see from that. And the spacing between the vertebra is pretty much gone, with extensive amount of bone change formation and a lot of arthritis on the end plate of the vertebra and also on the back joint spaces of the lumbar spine as well. So typically we start to lose proper direct blood supply to the disc at around age 13 and 14 years old. So before age 14 years old, we actually have direct blood supply going into the disc. So no matter how much abnormal movement or abnormal stresses that you put on your joints, you still get blood supply going to the disc at that early age, which prevents any further deterioration to the disc. So your disc is always being nourished, so therefore it doesn't have a chance of causing degenerative changes and causing damage to the disc itself. Now, after 14 years of age, the blood supply that goes into the disc naturally atrophies, means it disappears. So how we reach a proper nourishment to the disc is through a process of something called diffusion or osmosis. So what that means is it's like spraying a perfume in a room. Initially, when you come into the room, you'll smell the perfume. But if the air doesn't move, you won't smell the perfume from one end of the room to the other. The only way that you can actually smell the perfume is if you're able to kind of move the air around, so the smell starts to kind of dissipate throughout the whole room. It's a similar process in which if the disc doesn't have blood supply, due to the lack of direct blood supply to the disc, it relies on a process of diffusion or osmosis, where the proper movement, the movement of the disc allows the nutrient to actually absorb into the disc. So if you don't have movement, just kind of similar to, no different from if you kind of move your hand in the room and you smell the perfume, if the air movement doesn't exist in the room, you won't smell the perfume. Same thing with the lumbar spine. If there is no movement to the vertebra, then the disc does not receive enough nutrient through a process of diffusion or osmosis. So what ends up happening is, when our body is in good motion and it has a good range of motion throughout your spine, your disc is always getting proper nourishment. But when you have injury or you sit for a long period of time, the spine can cause fixation or torsion. It starts to cause locking. So when there's fixation, there's not a proper movement to the vertebra. So therefore, lack of movement leads to not enough nutrition going into the disc, which eventually cause starvation to the disc. So when your disc doesn't get proper nourishment, it will eventually lead to thinning of the disc. So the disc starts to kind of thin out. It starts to what we call atrophy, and eventually the integrity of the disc starts to get weaker, so it causes fissures and tears. And these fissures and tear, along with lack of nutrition and lack of hydration, causes imbalance and causes weakness to the vertebral joint and to the vertebra itself, which eventually the body realizes, since it's not moving very well, it starts to lead to more arthritic changes going on into the spine, which cause eventual fusion. Okay, so what we do in our clinic is we want to make sure that when a person starts to move, not only are they just kind of moving the area that's moving very well, like for instance, if your joints are moving well in one part of the area, but the other part is fixated or stuck, our job is to locate those areas and allow proper mobility, proper range of motion, so that way your spine starts to actually move well. So that's the whole process of getting your spine adjusted. And in order to do that, we need to make sure your spine is actually properly examined, properly checked, and doing a history examination, maybe taking some x-ray is a necessary step in which we need to determine what type of problem that you may be having. And through that, through proper and specific care, we can actually manage these segments that are stuck. And so we can unlock these segments that are stuck, so that way you can continue to exercise and stretch to compound the improvements that we have done for you. Okay, so this is Dr. Yoon. Hopefully this gives you some clear information about disc health and the things that we do here at our clinic to ensure your spine starts to move well and to continue to have an active and healthy lifestyle that we all long for and that we all look for. So have a great week and take care.